Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Friday, June 11th. Welcome to you and welcome to Ed Brubaker, our Living Branches President and CEO. Nice to see you. It's been a while.
Yeah, good to see you again. It has been a while. I don't know what number video we're up to now, but it also feels like eventually we'll be winding these down too.
Yeah.
But yes, it's good to be back again.
Well, let's start with our COVID counts on campuses, and that's easy because the number is 0. So at the present time, we do not have staff or residents testing positive for COVID, which is great news because almost 10 days ago, we had a person test positive in Dock Terrace who was a resident. So maybe we should just talk about that for a second, because I did get a fair number of emails from family members saying, how is this possible? What's going on?
Yeah, that's right. Unless we think there's no staff out, there's no staff that are positive, but we do have some, I think it's 2 maybe, that are out right now because of exposure or whatever. And I can't even remember if the staff members were vaccinated or not. But the point is, it's still around. Yeah, related to Dock Terrace, that was an interesting situation because they had been tested, were negative in the hospital, came from the hospital, and that our protocol is today a day 4 and day 11 test after the initial one that they come out of the hospital. Day 4, they tested positive.
Yeah.
So that meant the wing they were on until day 4 was now an exposed wing. Then they were put into isolation. You know, the plastic or whatever you want to say, the barrier was put at their door. And so that was, unlike in the past, it was only their room that was red zone. It was not the entire hallway.
Yep.
So a lot of things has changed in that regard. And then day 11, they were negative. So it was kind of an odd situation. We believed that it was a true test, but there were other complications with their the reality of their health too, and the efficacy of the vaccine is not the same for everybody depending on underlying health conditions.
Yep.
The other thing to say too is that the vaccine does not mean you will never get COVID. That is a mistake to say that. It is still a success when it tamps down symptoms. And so that's a key thing to keep in mind. I had a physician tell me the other day, he hates the term breakthrough case because it makes it sound like, well, it broke through the vaccine and the vaccine is supposed to say no to COVID. Well, that's not really quite true. It doesn't 100% prevent it. Number one, it's only 95% efficacy, but also it's about reducing the risk of exposure and transmission, but also your own symptoms. So we don't want to at all come across or have people think that that was a lack of success for the vaccine. The other thing is we thought the person was negative when they came to us, and it wasn't until day 4 that they tested positive. So did they test positive did they get in the hospital? We don't know where they contracted it or how it happened. And what we don't know too is whether they were transmitting the virus. We'll talk in a bit as to why we think it was minimal to no transmission. But so there's a lot of factors there. And I totally understand why people would say, well, gee, I thought we were done with this. Well, number one, we're not. In fact, Grandview, physician there was telling me that they have 6 COVID positive residents at Grandview, and there were only 16 in all of Bucks County. So they had a significant number of them. But the reality is it's not gone.
Yeah.
It is shifting to a bit younger age population, 40s, 50s, 60s, and people are still dying, frankly. There was some local deaths I was told about recently. So it's still out there, but it is so different. And the way we manage this disease going forward, I think, is going to continue to change and morph. But for us to think that it means there's not going to be any more cases, any more shutdown, that's not true, because we're going to close down for flu in the future again, too, like we did in the past. Now, crazily enough, we didn't have any of that. None, 0.
Yeah.
This past winter.
Yeah,
I mean,
no
that is
flu.
just so unusual. But we used to be closing down for flu or neurovirus or whatever. So, yeah, it's just to try to find perspective and balance.
And I think it is important to point out that we're not going to achieve eradication
Correct.
of COVID.
That's right.
But we certainly can manage it. And we're feeling more confident in our ability to do that right now. I know you had a conversation with the Director of Healthcare Services at Doc Woods about what having a majority of residents and staff vaccinated has done in this particular case.
Yeah, it makes a huge difference. And I think your comment too, we would understand that, the eradication, like in some ways polio is eradicated, may not happen with COVID. Time will tell. But yeah, in the particular case with this she was reflecting that this was really the first resident case where we had to do protocol testing, I think since December is what she had indicated. December, if you recall, was pre-vaccine.
Yep.
Okay, so this was kind of the first time post-vaccine. So we have to do a baseline test of all staff, all residents, and then 2 more tests. I think it's day 7, day 14. Yep. So that's a total of 3. It was the first time since the beginning of COVID that this particular round of Doc Terrace, that the first round of protocol testing, that nobody else tested positive. And I think that was then also true of day 7.
Yes.
And I don't know if
we haven't done 14 yet. That's Monday.
Yeah. Mm-hmm. And we anticipate that to be the same. So that to me is a big deal.
Yeah.
Okay.
Huge.
It shows the vaccine works. Yep. And I want to emphasize that too, because there are still people out there, for whatever reason, are not taking the vaccine. And in some ways, there may be, depending on us, who did take the vaccine or other reasons, whatever they may be. But I still encourage, cajole, highly recommend, get the vaccine. It is so helpful. And maybe we can eradicate it if everybody gets the vaccine.
Yep.
But we're not there yet. But our numbers are pretty good, both in staff and residents. But that illustration of Doc Terrace, I believe, is an illustration of how the vaccine works.
And we're going to be talking a lot more about vaccine in the coming weeks and months because some of the regulations regarding vaccination have changed especially for skilled nursing areas.
Yeah, that's right. And basically what's changed is, as part of our survey process in healthcare, we need to show that we have educated residents and staff about the vaccine, the safety of the vaccine, the need for the vaccine, all that kind of thing. And it needs to be documented for skilled nursing, or we call it healthcare. So there's going to be more of that coming again. So for those people who thought it was a lot in the past, well, sorry, it's going to continue. Yeah, we're back, like Arnold Schwarzenegger. And so, yeah, so that is going to continue, but that's an important thing. I think we need to continue to educate and show people that it's we are so fortunate to have the ability to get the vaccine. But yes, we're going to be doing that. We have some local physicians who are kind enough to make themselves available to us to educate, and they both happen to be female, which is wonderful, because one of the things that people talk about is infertility and the vaccine, which is not factually based, but we need to help people understand and talk to them in calm, appropriate settings to talk about this. The latest I was hearing was, the magnetizing.
I saw that video.
I saw a video and was kind of the illustration the woman was doing ended up being a fail. But there's just so much. So many stories out there of things that unfortunately are just not true. And, as my mother used to say, just because you saw it on the internet doesn't mean it's true. No, she never said that. I'm not sure that she knew what the internet was, but you know what I'm saying. Yep. We need to get our information from trusted sources.
Yeah. And we are going to continue our commitment to transparency. We've, of course, been reporting our COVID positive cases on our website, and now we're going to start doing that with vaccine percentages.
Yeah, so we want to report vaccine percentages for residents, staff, et cetera. And yeah, it kind of puts us maybe in a bit of a vulnerable spot because we're going to tell it what it is. But I think that's what we've been doing. We're committed to this. Some people may like it, may not like it because of what their own perspective is as to what's good enough or not good enough. But we just feel that it's the right thing to do, and we want to let people know. We have to report it to CMS for healthcare, so they're going to be publishing the data. If it happened as well as it did with the state, the accuracy levels were not always stellar, to be honest. Our accuracy, I would say, is pretty close to 100% with what we post. And we're going to post more than just what's required by CMS. It's been part of who we've tried to be pre-pandemic, during pandemic, and post-pandemic. So we've chosen to do that.
Yeah. We have a little bit of good news, I guess, too. We are continuing to relax some of our restrictions on campuses. And one of the things that we're going to be able to do starting the end of this month, June 28th, I think in particular, is that we are going to be, families and residents are going to be able to have family gatherings on our campuses again, which I think will be great.
Yeah, that's right. I think it's June 28th, you said, and looking at that. And yeah, it's just another part of the opening and reopening and the, I would say, thoughtful reopening, but also, understanding what the regulations are, how that happens. So it just really feels good to be at this place. And so, yeah, we're just glad to be here. It is not over, but I really feel we're at a good place, and it feels good to be able to do these things. It's so important to have those connections with family and other human beings.
I promised a couple of staff persons that I would make sure that we mentioned that family gatherings are not including memorial services at this time.
That's right.
Maybe we better talk a little bit about why that is.
Yeah, and memorial services is just a totally different event. Kind of trying to restrict the numbers and where the people are coming from and how close they're sitting together.
Are they vaccinated?
Are they vaccinated? There's just so many variables in the introduction of all those people, as opposed to a smaller, more confined, family gathering. So those are very different. At some point, absolutely, we want to be opening for that again, but yeah, we're just not ready to do that yet. And at the end of the day, it's for the protection of those we serve and for our staff as well.
Well, because we've certainly had some memorial services in the past where every seat was full and it was jam-packed. So
yeah, that's right. And I remember one huge memorial service just pre-COVID.
Yeah.
And I remember someone shaking my hand, and then I saw them later on seemingly blowing their nose like they had a cold. And I'm like, I immediately, I think, went to my office and popped a few airborne. but you think about that stuff, but we weren't doing that for the last year. So my defenses are probably lower because we weren't doing that stuff.
Yep.
And so, but it helped. Masks did not just protect us from COVID. It helped, with flu and many other things too. So it'll be interesting to say, okay, what is that? How should we evaluate that for the future?
Yeah. But we do want to get back there.
Yeah, absolutely.
Yeah.
Absolutely.
Any closing thoughts for us?
Well, yeah, I guess a reflection on the vaccine, and I harp on this a lot, and I don't really apologize for it, to be honest, because I really think it's that important. But I'm reading a book by Sebastian Junger. It's called Freedom, and the idea of what do we think freedom is, and who's actually free and who's not free. And we all have different opinions about that, right? And so we hear a lot of that in our society. Well, nobody's going to tell me what to do, those kinds of things. And it's just fascinating because I think we've lost maybe in some ways a sense of the interdependency that we really have. Nobody is truly independent. Last I checked, I didn't refine my own gasoline. I go to Bergey's to get that, right? I don't build my own car. I don't grow my own food, although Lucy has done some wonderful lettuce this year in her garden. But, you go to the grocery store, we're interdependent.
Yeah.
We depend on the federal government and the transportation, PennDOT and other federal systems to create interstate highway systems. We are in this together, and we can't just thumb our nose at things we don't like under the guise of freedom. And so this book has been just very fascinating to read of what we kind of have now distilled freedom to be in this country, which is so distorted in many ways. And so his one reflection was that, to restrict, persons using water, let's say in California because of a drought condition, that's no more a totalitarian regime than, modifying how we give out water on a lifeboat. If you have a gallon of water, you're not going to allow one person to drink it all at once. That's not totalitarianism. That's community, right? And the vaccine is community as well. To say that we don't want the vaccine because we don't do that stuff that's not tested, or we don't put things in our body that is a foreign thing. Diet soda is probably a foreign thing. Some people use it to clean rust off of pipes. It's like, let's really distill this down and say, are we in this together? Are we in this together? I'd like to think we still are. And frankly, as I look at our staff and our residents over the past year, we are in this together. I was on another video this morning with Missio Seminary and reflected that, sometimes if you read Facebook and Twitter, you can get depressed because
Very
it's
quickly.
like, you've got to be kidding me.
Yep.
Like, is that a nice way or an appropriate way to speak to another human being? Would you do that if you were in person?
Yep.
I hope not, frankly, but maybe you would. I don't know, but I hope not. But if you want to be inspired by humans, come to a retirement community, go to a nursing center, and see how staff have gone above and beyond and cared for residents. So, the antidote to Twitter and Facebook is come to Living Branches, observe what happens. You will be inspired by human beings and what they can do.
Yeah.
So I think for me, that's what I want to keep dwelling on, and need to stay off those other social media things that just depress me.
That's probably good advice. Thank you. Thank you to our viewers. If you have questions, please feel free to send them to me at coronavirusquestions@livingbranches.org. Happy to ask them to Ed in a future edition of our video. Thank you.